Exscribe really gives me the ability to access all of my data in just a few short keystrokes. It's amazing that I can go back and look at years and years of medical records and really come up with a formulation or a realization of the game plan so that I know what I was thinking 3, 4 years ago. I know what we did instantly with all the op reports that are available to me. I can access all the radiographs very quickly for the entire patient record. So it really gives me tremendous access to all the critical data that I need in order to make sure I'm consistent, that I'm thoughtful, and that I've addressed all the other issues that I've noted over the years. Well, my practice is limited to shoulder surgery, so my macros are easy. There are probably about 10 or 15 different problems that present themselves clinically. So it's easy for me to go in and fill in a macro, making sure that I've done all of my physical exam. It also helps me have in my brain what it is that I need to fill in so I don't miss any exam points. Even though you'd think at this point in my career I wouldn't need to do that, it's always nice to have a little reminder. But the macros are great. We have one for rotator cuff tears, we have one for osteoarthritis, we have one for frozen shoulder. So it makes it very easy to go in and fill in the exact numbers that we need in order to accurately reflect the exam. But it really speeds things along. One of the things I do not like when I go see my doctors is the fact that they're talking to their tablet more than they're talking to me. So I never carry anything into the room. I go in, I can sit down and listen to someone to hear their story, and oftentimes their stories can be pretty exhaustive. But to listen to the story and then to make sure I focus my exam based on what they've told me, and so I can listen to what they have to say. I can repeat back and validate what they're telling me. To let them know that I did listen to them and did understand them. And then when I walk out of the room, when I'm done with my examination and ordering any tests, I can very quickly enter that. I never go to the next patient. I always do it exactly then. It's very quick, it's very efficient. So the macros allow me to develop a very concise, very accurate record and in a way that's both pleasing to the patient and it's accurate for medical legal purposes. It's been great. We have really enjoyed the fact that you respond to us very quickly. Anytime we need a new macro or a new fix or whatever, the response has been great. And I'm relying on Bill Fall, my practice manager, to tell me that. But I say, hey, Bill, did you get this fixed? And he said, well, they told me how to do this. Like if we need to add physical therapy sites on the physical therapy order module, very easy to do. And now he knows how to do that. And so one of the shot, the injection for the intra-articular injections and subcriminal injections, the volumes were wrong. So with one phone call, Bill was able to find out how to modify that to accurately reflect what we do. So it doesn't show that I'm putting 10 cc's of fluid into somebody's shoulder when they only do 3. So that sort of thing. It's just very easy to correct things to accurately reflect what we do, and the records are terrific. Oh, I'd say sometimes it's creating forms. My personal favorite feature are the macros. There's no question about that because it really, as I mentioned before, makes things so accurate and so easy to deal with. But I like the fact that I can access whatever I need to from whenever we've seen somebody very, very quickly to see how they work. So if I have somebody come in who has a cuff tear, a rotator cuff tear, I can go back and look and see exactly what was done. If it's one of mine who failed, which hopefully not very many of them, but when it is, you can actually pull up exactly what anchor I used, everything that I've done, the technique I used for the repair. So there's no question, and it happens in just a matter of seconds instead of having to dig back through a big thick paper chart. But it's very much a time saver for us, and it's a very intuitive system. Also, I have to say, very easy to learn. Our break-in period was about 10 days to 2 weeks, which for a very busy practice is not easy to do, but it became very, very second nature very quickly to be able to use it to navigate it and to do all the things we need to do accurately and efficiently. I'd say compare. to have a look, look at the competition. We did a pretty exhaustive evaluation of the various electronic health records. One of our doctors, Eli Hurwitz, has a master's in engineering as well as an MBA. So we put Eli on it. We said, all right, Eli, you tell us which one that we need to use, and then you bring the three that we should decide upon. And I think our choice for Exscribe was pretty universal. But have a look at it. I mean, have a look at what you're trying to convey in your note. Have a look at what the critical data are that you have to have as part of your note in order to have a very solid medical legal document, but also a solid clinical document. So when you look at that and you figure out what is it I can do that makes me efficient, what is it I can do that really provides an accurate picture of my thought process, then I'd say I think you'll end up with Exscribe. But we certainly have been very happy with it. 4 years now, hard to believe. When we generate the histories and physicals, it's very simple to go back to our most recent note and to update that. So it saves us a lot of time. And our PAs love it as well, since they're responsible for generating all the H&Ps. Yeah. But it's nice. It's just easy to use.